In second degree heart block, what happens is that the impulse is coming from the SA node, gets a nodal delay and go down to ventricle. But in between that, certain impulses may lose their way and may not pass. Again, the next impulse gets to pass. So there is a sudden loss of one or multiple impulses which do not go to the ventricles. So basically, few impulses fail to propagate to ventricle. Few impulses fail to propagate to the ventricles. Now, how will the ECG look if this happens? Suppose this is the normal ECG. But in case of this scenario, there will be one P wave, as in case of the first impulse. Then there will be QRS complex. But over here, the second impulse in the image doesn't get passed to the ventricle. So there won't be any QRS. Then there will be the third impulse, which gets a QRS. So there will be a missing QRS in between. So this will be the presentation of a second degree heart block. Right? Now, how second degree heart block precipitates? In a scenario of a first degree heart block, if you increase the dose of AV blocker that you're giving, a first degree heart block will get converted into a second degree heart block. Now, secondary heart block can be of different types. Now, in the first graph that you can get to see over here, you can see that the PR interval is progressively increasing. This is the PR interval over here, and then the PR interval increased further, then the PR interval again increased further, and this increase ultimately leads to, finally, there's a P wave, but after that, there's a lost QRS or QRS drop. So basically, there's a progressive PR increase, finally leading to a QRS drop. This type of second degree heart block is known as a Mobitz type 1. Type 1 of block. Then we can have another scenario where we have the PR intervals are fixed. But in the scenario of fixed PR intervals, there is a QRS drop. So fixed PR intervals leading to a QRS drop, this scenario is known as a Mobitz type 2. Or there can be another scenario where you can see that after every 1 P wave, 2 P waves, there is a QRS complex. Again, 1 P wave, second P wave, QRS complex. 1 P wave, second P wave, QRS complex. So after every 2 P wave, there is one QRS complex. So this is known as 2:1 block. Suppose after every X P wave, you get a QRS complex. Then in that scenario, it will be X:1 block. X will be the number of P waves before the QRS. So these are the subtypes of your second degree heart block.